Hello, I'm David Middleton. I'm going to be your host for this short video aimed at helping folks, perhaps yourself, who are turning 65 and starting on Medicare soon, understand what you need to know and do in the months leading up to you starting on Medicare. Did you know every day in the United States, 10,000 people turn 65? Are you one of the lucky ones like my wife and I who are turning 65 in the next year in 2024 and starting on Medicare? Well, if you are, then this video is for you to take you by the hand and walk you through the ins and outs and the ups and the downs of the Medicare maze. If you're turning 65 and starting on Medicare in the next year, the best thing I can say to you is buckle up your seatbelt because you're about to get bombarded and bamboozled with more calls, mail, and commercials than you ever dreamed possible, all with one main objective, and that is to enroll you in a Medicare plan, whether you know much of anything about what you just did or not. And in an effort to make sure that that doesn't happen to you, that you don't get blindsided or become a victim to those relentless call centers who only care about enrolling you and not much more, I'm going to explain as simply and briefly as I know how all that you need to know and do in the 6 months leading up to you starting on Medicare. And we're going to break this down into three parts. I'm going to use the airplane analogy here. Part one is 6 months out, making your initial descent into Medicare. Part two is 3 months out, preparing for landing into Medicare. And part three, 1 month out, touching down into Medicare. Let's get started here on part one, 6 months out. Here's the three main things you need to be focused on. Number one, get clear on the starting point of Medicare. Number two, get informed on the basics of Medicare. And number three, get registered with an account on SSA, socialsecurity.gov. All right, on point number one, there's two types of people that are coming up on 65. Those that are retired and need to start on Medicare, and those that are still working and need to delay their Medicare. So for those that are retired and need to start on Medicare, there's two types of those people. Those that are drawing Social Security and those that are not drawing Social Security. Let's look at each one of those. But first of all, here's an important fact regarding your initial enrollment period into Medicare. It's a 6 month, 7 month window that begins 3 months before your 65th birthday month and goes 3 months after. So if John's birthday is October 27th, his Medicare is going to start on October 1st, and then you go 3 months back before then, and then 3 months after the month of October. Your Medicare is always going to begin the first day of the month that you turn 65, unless your birthday is the first day of the month. Then it's going to bump to the first day of the previous month. So just be mindful of that. And if you don't sign up for Medicare during this initial enrollment period, you may have to pay Part B and Part D late enrollment penalties. Now, for those that are retired and drawing Social Security already, you're going to automatically be enrolled into Medicare. You'll receive that red, white, and blue Medicare card almost exactly 3.5 months prior to the first day of your 65th birthday month. And that Part B monthly premium, which is $174.70 for 2024, will start being deducted from your Social Security check in your 65th birthday month or soon thereafter. Now, for those that are not drawing Social Security and coming up on 65, you're not going to be automatically enrolled in Medicare. You must manually enroll, and we'll look more closely at that in the next section. You'll be mailed a quarterly bill for the Part B premium on or before your 65th birthday month. So quarterly means it's going to be about $524 and some change. So get ready for that. And for those that are still working and need to delay their Medicare, there's two types of still working people: those that dislike their health insurance and want to start on Medicare, and those that like their health insurance and want to stay on it. Here's a chart that can be helpful for you for an important fact regarding your special enrollment period. That comes into play when you plan on retiring and or will be losing your group health insurance. Hopefully this chart below will be helpful to you. For those that are in a group that's 20 or less employees, you should enroll into Medicare Parts A and B. Your Medicare is going to become primary and group health insurance secondary. For those in a group that's over 20 employees, you can stay on that group health plan, and Medicare enrollment is optional. There's no penalty if you don't enroll at that time. And for those that dislike their health insurance and want to start on Medicare, you should compare your current group health insurance plans, copays, and benefits with Medicare plans. And if you prefer Medicare, you can enroll up to 6 months before your 65th birthday month. That's in a supplement. An Advantage plan would be within 3 months of your 65th birthday month. So those that like their health insurance and want to stay on it, that is perfectly fine. You may do so without incurring any penalty from Medicare later on, because most group health care plans are considered creditable coverage. Second, you may still want to compare your current group health insurance plans, copays, and benefits with Medicare plans. All right, number two in part one is get informed on the basics of Medicare. Whether you're new to Medicare or a veteran of it, it can feel incredibly confusing and complicated. You need to learn the new set of ABCs and D of Medicare, and we've got you covered on that with a brief but very informative video. You just want to go to gimmethebasics.com. We've got that short video, less than 20 minutes on there. Go to gimmethebasics.com and you get the information that you need. Topics that are covered in that video, Medicare and what it covers, when to enroll and when you can change plans, how to enroll in Medicare, your two main options, including Part D, and how to decide on the best plan for you. Okay, point number three under Part one is to get registered with an account on SSA.gov's website. This is important and useful for several reasons going forward. Checking future Social Security benefits, applying online for Medicare Parts A and B if you're not drawing Social Security when approaching your 65th birthday, and then applying for Social Security benefits, etc. All right, the steps to creating a My Social Security account. Step number one, go to that website and select the Create an Account button. If you don't have a login.gov or ID.me account, select the Create an Account link to create a login.gov credential to access your personal My Social Security account. Number three, if you create a new login.gov credential, you'll still need to provide some personal information to verify your identity, and you'll also receive an activation code to complete the process. Four, read and agree to the My Social Security terms of service prior to accessing your account. Number five, now that you've successfully created your account, choose email or text under Message Center preferences to receive courtesy notifications for notices and messages from SSA. Great thing about this video, if you want to come back to these points again, you can do so. Well, congratulations, you've now completed your initial descent into Medicare. Now let's prepare for landing with part two, 3 months out. All right, there's two different tracks here, those that are already drawing Social Security and those that are not. So for those that are already drawing Social Security, you should have already received your red, white, and blue card in the mail. If so, store it away in a safe place where you know where you put it. If not, you need to call Medicare, or you can call us and we can help you with that. Number two, rewatch the Medicare Basics video to refresh your understanding of Medicare. And number three, schedule an appointment with an independent agent to choose the Medicare plan that's based on your doctors and medications being covered. And for those that are not already drawing Social Security, you need to apply online for Medicare Parts A and B through the SSA website. You can do it yourself or you can call us. We'll be happy to help you at no charge. Once this is submitted, it'll be about 30 to 40 days before you'll be issued a Medicare ID number. And then number two, rewatch the Medicare Basics video to refresh your understanding of Medicare. And again, schedule an appointment with an independent agent to choose the Medicare plan that's based on your doctors and medications being covered. Well, congratulations, you now completed parts 1 and 2. Now let's touch down into Medicare, part 3, 1 month out. Final steps here. Secure your red, white, and blue Medicare card or call Medicare with your agent to get your ID number. If you've already chosen a Medicare plan with your independent agent's help, be on the lookout for your new plan cards and welcome packet. And once received, secure those cards until your plan goes into effect. And when the welcome packet arrives, take some time to become familiar with your new plan's copays and benefits. Number four, clarify any remaining questions or issues with your new agent and make sure you have his or her phone number. And then use this final checklist to complete the process. Can I continue to see my preferred doctors and providers? Are the benefits I need included in the plan? Dental, vision, hearing, over the counter, fitness, etc. Are my prescription drugs covered? And if so, what will they cost? What are the plan's copays and deductibles, both medical and or drug deductible? And how much will I pay in total premiums each month, including the monthly Part B premium, your Medicare Advantage plan itself, and any ancillary benefits like hospital indemnity or cancer? Congratulations, your Medicare effective date has arrived. You're now an official member of the Golden Age group. Share that new Medicare card with pride. And here's a reminder of what we're here for is to help you understand the basics of Medicare up front, eliminate the confusion and complexity of Medicare, help you to get enrolled into a Medicare plan that's right for you and get off to a smooth start. We're available to you year round whenever needed, and especially in the annual enrollment period in the fall. And to protect you long term from agents and call centers that don't have your best interest in mind. And finally, you get all of this completely free of charge, both now and going forward, because we get paid by the companies that we enroll people in. And this couple on the right, they know that full well. That's my mom and dad. Okay, we hope this video has been helpful to you. It's been our joy and privilege to connect with you and help you better understand Medicare and what you need to know and do to be ready when your golden age of 65 begins. If this has been helpful to you, share it with others you know who could be helped by it as well. And reach out to us either on our website at teammiddletonhealthcare.com or the phone number that you can see there. God bless, take care, and hope to hear from you soon.